What a new day. Well, guess what? Brand new content. Today I have Rose Hurd with me. She is a local resident to Tulsa as well as me. She's also been working in the childbirth field for decades and is an awesome resource not only for the childbirth community as a whole, but especially for women of color. And Rose is going to teach us some stuff today about what that experience is like. Me being quite white, I can't give that information. So thank goodness for Rose and her resource and knowledge. So welcome, Rose.
Thank you. I'm glad to be here.
Yay. So we'll just dive into some womanly conversations here. So I would love to learn from you what you know that is different, or what you've seen or experienced as a doula and an advocate about the experience of moms of color during like pregnancy and labor.
I would first want to answer that with my own story, and that is also my why I'm doing the things I do, other than the history in my family. And so I'm going to go back to my first birth. During the pregnancy, everything was okay. Everything was normal, but then something changed. And I had discovered a week before I gave birth that I had a baby that was breech. And I was told what to do as far as with a breech birth, and as far as with trying to get her to turn before I gave birth. But when I entered the hospital, it was quite different. It's much more different now than it was then. So when I entered the hospital, I had a resident, I do believe, that came in. He noticed baby was breech. He left, had someone to come in and prep me for a C-section. Nothing was told to me. The lady that was prepping me was a person that said, well, we're getting you ready for a breech birth. So this decision was made for me, not with me. And then another doctor came in with the resident and said, no, she does not need a breech birth. I was praying all along anyways, please, I don't want to have a C-section. So please, God, my mom had breech births. I can do this. And this doctor said, no, she does not need a C-section. She can give birth. Just have everything ready in case of an emergency, which was great, which I was so thankful for. But I also noticed that neither decision was made with me. And so as I journey on, I noticed that in hospital births, a lot of the decisions were made without the mother and the family being involved. That was 40 years ago. My daughter's 40 years old. Breech birth, she's fine, healthy, beautiful, I must say. But as I fast forward and came into really doing this work, just a little bit fast forward, my sister having a baby, it was a C-section, and I noticed that there were an exorbitant amount of C-sections compared to what it used to be with vaginal births. And then when I decided to officially become a doula, I also noticed that when it came to women of color, there were some caring people, but there were people that ignored them. So most of the moms that I worked with were mothers that went to learning hospitals. I've seen the coercion into doing things they did not want to do, where mothers were being coerced to go in and have an induction. And when a mother said, I wanted this to be spontaneous as possible. I've seen it where mothers have said, if monitor me, whatever it is you got to do, I want to do this naturally. I want this baby to come naturally. And I've seen scenarios rise in order to talk this mother into getting an induction. Because now a lot of the mothers I work with are what I call them advanced maternal age, where they're 35 or over. And so that's always a question of an induction. And a lot of them will say, well, if it's medically needed, go ahead, then we'll talk about it, and the medical scenarios will rise. And I've seen where as the mother is still making decisions, they're in the hospital, they're progressing okay, and then someone comes in with the Pitocin question. And I've actually seen the 4 doctors in a group surround a mother, the head person, when that mother said, I do not want to try Pitocin because I'm afraid of a C-section. I've seen I saw this doctor who was a woman roll her eyes in the back of her head and say, you're not going to have a C-section. This mother was afraid because her sister had C-sections and they didn't acknowledge her fear. And that's what she was telling them. And all down the hall, every time someone walks past the door, we're hearing somebody being prepared for C-section. So that's what she thought was going to happen to her. So, and I'm seeing this constantly. I also work in the breastfeeding world. The birth stories that I hear also are things were going okay, and then all of a sudden we got Pitocin, and then there was a C-section. I told them I didn't want to do that. I've heard my mom say that the doctor said, well, let's go ahead and induce. You're 36 weeks. We can start talking about induction. And the mother said, but my baby's still growing in my body. And the doctor said, well, most mothers want their body back. And this mother was like, I'm growing my baby. That's what my body is for. So I'm hearing these mothers, now they are starting to advocate for themselves. I'm hearing these mothers saying that, no, in some cases, nobody's listening. And now I'm hearing these mothers say, hey, this doctor just did not seem like the right doctor for me. I had to make a change. Whereas at first, most of the moms felt that they just had to submit to what was even suggested or recommended without a decision. As I educate and talk to mothers and explain to them the interventions, then they understand now that they have a choice. So mothers are now learning we have a choice. And if a doctor is not listening, we know what to do. And I understand that a lot of doctors mean well. And I do understand that, with insurance companies, they don't have a lot of time for the moms and the families to really ask a lot of questions. And so, and I have witnessed that as well. I want these mothers to have, when they consent to things, to be truly informed. With that, we have to take some time out to explain, so these mothers understand, so that they truly are making informed choices at birth.
Awesome. Yes. What would you say is like a main struggle that moms of color deal with in obstetrics?
We can go back to history and understand, that person that was named the father of gynecology and all of that.
Dr.
We can go back that far. We can also go back as far as, people keep bringing it up, and someone said, why do we keep bringing it up? All the different medical discoveries that were made through people of color, the tests and things like that, or people with low income, and I add that too. We can go that far, and we can also say that we still are seeing in certain medical books, or how people are trained, that there's a difference between people of color and others. As a matter of fact, I was in not a childbirth, but a breastfeeding educator class to be certified as a breastfeeding educator. And it was placed right in front of me on the screen that teenage girls don't breastfeed and Black people don't breastfeed. Well, I was a teenage Black mother breastfeeding, and I think that's why they were shocked when I had my baby, and I requested that, because that study has been going on that far and that long. So a lot of times I believe it's what's been passed down in the medical world on the beliefs that people have on people of color. I've even had a doctor of color say that her colleagues refer her all of the patients that have Medicaid instead of taking care of them in their office, they send them to her, and they tell her she's a great doctor, and she says, well, if they refer me and I'm a great doctor, why are you not referring other people to me? Not that she's want to turn them down, but we can all help serve in this area, and all people that are on Medicaid are not all people of color, but you just have to, that's how I see it. So I think it's just the beliefs that have been passed down for so long on what we do or what we want, about how we feel, how we think, how we feel pain. Our skin is thicker. All of these little things, have been passed down for years. And, even your first year residents come in with these beliefs. And that's what we've gone and done the research that first year residents come in with beliefs on people of with different beliefs on people of color that are biased. So, but the main thing is that I think in the medical field, implicit bias has been going on for a long time. And it's finally come to light as we start discussing maternal mortality and morbidity and the rates of infant mortality and morbidity. So it's starting to come to light, I think, right at 2016 when I decided to officially wear the doula hat, become a doula.
Yay. Awesome. How often have you seen moms of color get pain relief that they ask for?
I truly believe that they don't mind giving them. As a matter of fact, they don't have to ask.
Oh, yeah.
It's pushed on them. Would you like something for pain? Would you like something for pain? I had a mom that was experiencing the birth of a stillborn baby. And her goal was to go through the birth the way she wanted to experience it. She's not going to take a baby home with her. And so she wanted to go through the whole experience without medication. And there was a nurse that was not really experienced in stillbirth. And she literally was pushing. You don't have to suffer. You don't have to suffer. You don't have to suffer. You can take some pain relief. And a lot of times it's offered. And even when the mothers say, I know I want to have this birth naturally, it's pushed. So
for a lot of moms, yeah.
For a lot of moms, what's going on here? And it's pushed. And sometimes we do know that when the anesthesiologist is on the floor, they try to make sure that they help them out and get them about 3 or 4 moms at a time so that they don't have to keep coming back and forth to the floor. So, but for the most part, it's pushed, even when the mom is saying no. And I've even had a few nurses to look out the corner of their eye at me as to say that I was the person that was encouraging them to go without a medicated birth. But we know how it affects, how these interventions affect breastfeeding. And so, and some women say, I've already gone, I had the epidural, I've had all of that. And I don't even know what happened. And I didn't feel anything. And I want to know what this actually feels like. And they're requesting a lot of times to have an unmedicated birth. And I do have some moms that when they say they do want to have pain relief, that they're actually getting it. They are actually getting it. But for the most part, it's being pushed.
Right.
10, 15, 20 times.
I bet.
Even with the no.
Yeah, that is definitely a lot more aggressive than the white moms. I haven't seen that much persistence with. Usually it's offered a couple of times, but not over and over and over.
I've seen that a lot.
Have you ever had much experience with moms who have not typical pregnancy or labor physical symptoms that get ignored or disregarded? Or
When it comes to symptoms, I'm not seeing anything ignored because things change when you have that birth person in the room. They
it's
do
true.
change. I can say that I did have a family member. Now, this is her story. She went through the pregnancy with a broken leg, and her doctor didn't notice that she had surgeries during this time, 4 surgeries altogether for this leg. And the doctor just basically scolded her on not making her appointments regularly. She checked the baby's heart rate on one of their visits and said, "Oh, the baby's heart rate is slow. We need to get this baby out. We need to induce." And then when she got her to the hospital, she goes, "How come you didn't tell me you've been taking Percocet?" Like, and she had been in a wheelchair every time she would go to see this doctor. And she had just had the external fixators taken out of her foot and leg. And she had on a boot during her labor. And she said, "All this time, I've been coming to you." And this same nurse, her sugar was high one day, and she had placed in her medical records that she had gestational diabetes. And she said, you gave me the little monitor to check my blood sugars at home. I did it all, and we've proven that there's no gestational diabetes. And this is a mom that knew a little bit that worked in the medical field on a lower level, so she understood what was going on. But this doctor had just been ignoring her all throughout the pregnancy, on what was going on with her with the broken leg, with 4 surgeries. I mean, it was like when she would ask her things, she didn't write it down or didn't pay attention. I don't know. So when she went to her next, she had another pregnancy, which was years later. Gestational diabetes came back up again. And she was like, "Look, we've gone through this before. I'm not sure why it's on these records because nobody here has ever told me anything about blood sugars off. This is an old record. What are you pulling up?" So things like that were happening with this particular mom. And when she made decisions on not doing every hour blood sugar test and things like that, they sent in somebody, I think, to another nurse of color that was older, the strong armor, and that particular nurse smiled and said, "I like you," and left. So, but that is the main person that I can truly say in the story that somebody was not ignoring. It had nothing to do with their pregnancy, but it was affecting the pregnancy. Baby is fine. The doctor who took care of the broken leg made sure that the baby was okay and was sent her to labor and delivery to make sure the baby was monitored after surgeries. But her OBGYN dropped the ball somewhere.
have you had any experience with moms or babies that have passed away during the childbearing year?
So as far as postpartum, no. But the stillbirths and miscarriages, I have experienced that. And for those mothers, I am there with them if they want me to be. I had the one mother with the stillbirth. I haven't done many stillbirths, and I appreciated that experience. And at the same time that this was happening, I had gotten certified for to be a postpartum care provider. And I was allowed to also offer postpartum care. And I do offer postpartum care to women who have miscarried and who have terminated a pregnancy.
What would you say that moms of colors especially need?
The most important thing in their care during pregnancy is they need a listening ear. They need to always know that they have choices. They need a lot of postpartum care and support. And I would say all mothers do, but they need a lot of support. And that's what I offer. The postpartum part, having that person that's there that can help monitor and see what's going on with mother and baby if they're breastfeeding. They need a lot of breastfeeding support. And the mothers that I talk to who have had births already that attempted breastfeeding tell me that the support is not there. So mainly it's the support, and it's the love and the care, and it's the resources. They need to know the resources that are available. And they need to know that there are women that are coming out who are there to support them throughout their pregnancy and their birth. And they need outlets in order for them to share their stories and their birth stories. And they need to be surrounded in circles with other women. And all mothers need to know that they are not alone in this, and they should not be alone.
Awesome. Very true. What would you say helps moms of color especially?
So the one thing that I try to do for moms of color is, because I understand that there is, we're also in a community of trauma. And so we're still working with the trauma from even slavery. And we're still working for trauma that's being perpetuated because of different biases and inequities. And we still have systemic racism that is out there. And so what mothers need, and that I try to offer, are those buffers where we can find ways to relieve some of that stress, because we understand that the stress from the trauma that you're getting, even if it's like racial microaggressions that are out there, even when they go to the doctor's offices, I see the moms looked at differently. I'll say this, even when there was a mom that had the multiple births, someone said another welfare baby, a bunch of welfare babies, da-da-da-da. So the thing is that what I see that helps these mothers most is that caring person, that those loving hands that person gives to them, that person that helps them, that guides them through that stress, teaching them how to relieve some of those stressors, how to be able to get out and face the next day without triggering some trauma. That's one of the things that I see that helps mothers, finding ways to do that, finding other people who can say, I've been there and I can help you and I can listen to you. That's what helps the most. It's just having someone to listen to, and having someone that they can say, okay, I trust this person in my community, and I know that they're not going to steer me in the wrong way. And they need people to be genuine, and, in my word, authentic, and with people with intent in what they do for them. That's what helps.
I agree. Yeah, science backs that up, that support is probably the key help for anyone going through the childbearing year, but especially for those that are at risk or underserved. Support is the biggest issue, the biggest help.
And just meeting them where they are is really, really important in understanding, meeting them and not treating each person the same, like a little cookie cutter. Each person have different levels of trauma, or just it's different personalities. We're all different, so just treat each person individually how they need to be treated, and meet each of their individual needs.
Awesome.
I always refer also to the Black Mamas Matters pages, white pages. When we talk about that, we say that women of color need a more holistic approach to their care. So for me, that approach deals with the environment around them, who's around them, their history, their thoughts, their fears. And then we also know the holistic approach takes care of their emotions. I'll just say the the body, the mind, and the spirit. And that's where what helps the mothers of color the most. Coming from, I'll just say, in my whole life, and then the human development family sciences background, I've always have thought to look at the bigger picture. Even when working with children, I've always looked at the bigger picture. So when I went into the birth world exclusively, I look at the bigger picture. It's a reason why I walk into your home. And it's a reason why I need to know grandma, mother, dad, auntie. Do you have babies? Cat, dog? I have to know. I have to see it. How do you believe spiritually? When I walk into that door, these are the things I need to learn and discover about each mother, and it helps me understand how to care for her. I've cared for homeless mothers that are in recovery from drugs. Knowing their background helps me to care for them in the way that they need. It even makes me research even more on how to care for mothers. When the first mother came and said, I'm in recovery, I just quit drugs as soon as I found out I was pregnant. I was like, okay, now I need to learn more. I need to learn more. And also having resources, because these mothers do come out, and there's always that chance that, child protection services will get involved. So what do I do for this mom that needs to make sure she has a place to stay or a place to go with this baby while they wait to see if the baby, hopefully not, is being removed from her, or the cord blood has to be tested to see if there was a transference. So all of these things come into play, and each person, as I reach them holistically, they're also reaching me holistically. I learn so much more from each person. The holistic approach is necessary for women of color to be able to meet their needs.
I personally believe that if we gave all moms the resources that moms of color need, then our maternal mortality rate would just tank.
It would. And I really feel that way. And so, and you got to think about your maternal mortality rate, because that it goes all the way to even the postpartum. Because if they die within that first year, that baby's birth, that's part of it. That's maternal mortality. And you got to think about who's in that house. Are they being abused? That's part of it. That's maternal mortality. Are they being abused? And like right now with COVID. So,
yeah, that makes everything worse.
Mm-hmm. Can we find resources to remove this mother from that? Is this mother willing to be removed from it? How do we approach her and just say, hey, this is a way to protect yourself? What do we do? Give that same approach to every mother. Have that equity.
Exactly.
I always tell everybody, my whole reason, I think, for doing everything that I do is basically, what would you say? It's in the blood. It's inherited. My favorite midwife that gave me my certification, when she said that your ancestral history is in your heart, that is where I pull everything from. Is from my heart, and that's the reason why the name With Love. And it just, every time I talk about it, it's just that part right there is from my heart. And I think that's what makes everything I do authentic. Okay, well, basically, the collective that will be mainly women of color, and that ranges in all colors and languages, who all share the same thoughts and feelings, and all have the same vision that I do. They don't all have to be birth workers or doulas. I cover a lot. So for me, I am a doula. I'm a childbirth educator. I do postpartum work. I'm a breastfeeding educator. I'm getting my certified lactation counseling credentials pretty soon. But there are some people that want to do postpartum work. There are some people that would like to just work with healing methods for moms all over, like massage, prenatal and postnatal massage. There are herbalists that are out there. There's birth photographers in the making. So whatever it is that they want to do that I can't do, basically that's what it is. I can't do it, so somebody else can do it. I want to be able to refer, and we just have a collective and a group where when a mom is expecting, they can come in as a one-stop shop. You can select who it is that you want, who works well for you, and then also have a resource for other things that you may need other than just a doula. And so that's what I'm working on. And I was looking at that one African proverb that says, if you want to go fast, you go alone. But if you want to go far, you go together. And so for me, I'm looking for those people who do want to go far and who would like to run together with me. And so it's right now, the collective is a little, it's a baby. It's a embryo. I don't know. It's still gestating. And so I have not given birth yet. So it's Tulsa Birth Warriors, because we're fighting for those lives. And I know how we are. We're fierce. And so I want us to stay fierce when it comes to birth. The whole reason why I'm so heavy in the traditional postpartum care deal, because my mama told me, but is because we're trying to raise that level of oxytocin to prevent these moms from having more mental health issues. And then it's also a great way, that self-care part helps with the mental health as well. Here are those tools that you can use. And then even when you had the baby, you can still use these tools. You can apply them to your life.
So I thought of another couple questions that might be more fun. When women of color gather around and talk about birth, what is that like? Whether it's just family discussions or baby showers, or are there other traditions that maybe other moms wouldn't know about for moms of color?
Like in my personal circle, I can tell you what happens in my family, and I'm hoping that it continues to be a tradition, because I'm now a great grandmother. And I'm like, yay, great grandmother. And I'm hoping that the tradition continues. That we do gather around and we do celebrate the mother. And I felt that the way that the celebration was brought to me as a great grandmother retrieved the baby from the mother, and then grandmother brought baby to great grandmother. And that's how I even laid my children into my mother's arms. Look, you got some more grandbabies. Look, it's a great grandbaby. And so in certain circles, we do have mothers that, in different ones, you have mothers that lovingly talk about the birth of their children and what all happened. Sometimes it gets scary. They mean well, but they do kind of suggest things that you may not want, but it keeps you in the light of what's out there. With each mother that I serve now, I do gather the family and friends and loved ones using traditional blessing way. There's the mother blessing is what I usually use. And how I use it is not just a place to do arts and crafts with the mom, but I kind of cater it to each mother to meet her needs. So I bring the families together. And the one thing moms always need after the baby is born are healing foods. So I share and cook with the family healing foods, and I share recipes. We pray with the mother. We pray our blessings on her. I had one mom, I was trying to put it together, but she decided to set it up herself and put her prayer board up for you to write the prayers. And we do foot bathing of the mother. If dad is involved, the last one I did there, he bathed the feet of the mother and honored her with words that were so beautiful. And everyone shared their stories. And there were moms that were pregnant in the room, and there were moms that had one or two or, like me, 5 babies. And we just picked the stories that we share. And then we put upon that mother our hopes and our wishes and our dreams as we leave the mother with food, of course, we leave her with food, and we're there to show our solidarity to her, that we'll be there even if we're not in the room with her. We are there with her, and then we'll be there when the baby is born, because what we're forming is that community, that tribe, that circle that their mother is going to need after she has a baby. This was done, and from my history, my mother always told me about her grandmother was a midwife. And she talked about how when she was a teenager, she saw all the women get together and go to the birthing mother's house, even after she had the baby, and make sure food was done and the babies were clean, and husband's out in the field working. And when he came home, there was food for him, and the mother had time to rest, and her and the baby got to get to know each other. And breastfeeding was successful because there were people there, and they prayed with her, and they prayed during the birth, and they prayed after the birth. So those things need to be brought back. And that's what we do in our circles with our mother blessings.
Every woman should be treated so well, but especially moms of color that are going through the stress of just everyday life. Kind of makes me think of a not as fun question. I know some of my research has been about the experience of late pregnancy and the way society pesters moms in their late third trimester. When are you going to get induced? You're still pregnant. You're big as a house.
Yeah.
Moms of color, what is this experience like? You've mentioned that there's a lot of times that white people, especially, I'm sure, are the perpetrators of saying, oh, it's just another welfare mother. But are there other similar things that moms of color have to deal with during pregnancy?
Yeah, it's the same in the late pregnancy with them. The people are like, and I remember, still pregnant, still, and it is, why did you get induced? And I've even had the mom that is in the hospital, and she's progressing well, and it's a first baby. So, first babies can it's a process. Where even people were saying, why don't we just get her a C-section and get it over with? And my goal is, as the mother labors, is to say, well, there's no medical emergency here. Baby is doing fine. Mother is doing fine. So we'll just continue to progress. She's doing just fine. And then I've also taught my moms, and I teach those who are the birth partner, what to do. And this mom just said, everybody shut up, because she was in there by herself. She said, could everybody be quiet, please? And that helps. When there is a father in the room or a birth partner in the room, that person that's going to be helping raise this baby in the room, I always let them know that you hold the charge. Mother has already interpreted to you what she wants, and now it's time for you to hold the charge. So when we do have those little pressures of other people, that person who holds the charge, even during the pregnancy, can say, this is how we're doing it. If they're in the birthing room, and we, because now it's almost like, now it's not, but before COVID, sometimes it was like a party in there. I tell them, when it's time for people to leave, even in the home births that I've attended, you are the person that says, okay, everybody out. You're bringing, that person, I'm teaching that person how to look at the birthing person and see and read their face, read their body, and know when it's like, oh, you all got to go. It's time to go. You must leave. I teach them even when the pressure is coming from the medical staff. When we want to try to do this, I teach them to say, I understand that that's something that you were ordered to do. Could you give us a minute to pray about it? Or could you give us some time to think about it, maybe an hour? And so we help release the medical staff that had the order, and it gives them time to really think about what they want to do. And my goal is to keep that mom in the zone. Wherever her level of consciousness is during her birth is where she needs to stay. And whatever her level of confidence is where she needs to stay. And we've been practicing this all during the pregnancy. So they already know how to do it. So we don't get as much pressure because we've been working on how to relieve that pressure throughout the pregnancy.
Awesome.
So when the pressure's on, when other people are talking, we already know what to do.
Awesome.
Mm-hmm.
Well, Rose, this has been a great discussion.
Mm-hmm.
I am really honored that you gave me a chance for us to talk about this and to spread the word for other people to learn about these subjects. More exciting, similar content is coming in the future. And to remind you to please, please be kind to all your fellow human beings, no matter their diversity.